we're now going to transition into the trial process. So he is now going to go from pre-deposition, preparation, deposition, and now we're going to start the trial process. And now I was his attorney, but my partner, because I'm having hip surgery on February 3rd, and that's true, I am going to have hip surgery, have it replaced. And so my partner is subbing in for me, and her name is Melissa Carter. Melissa Carter is a former insurance defense attorney as well. You're going to pick up a theme here. And she used to be with private practice, and then she got scooped up by Nationwide Insurance Company, and she was their in-house counsel on major fatalities and catastrophic events, representing the interest of their insureds. She's going to now be the patient's attorney, subbing in for me, because we can do that, just as you guys and gals can do that. And but before she begins, there's another attorney and a partner in our law firm who is here, but because he has a trial coming up pretty soon on a major youth football case, unfortunately another one happened a few years ago that we were involved in with the family. Arthur Learitz, you stand a second, and he is, like most of you, dressed down. So, but because of that trial, we said, you're out of this, we'll take care of this. So, Melissa, do you want this microphone, or you got that one? Yeah. All right, great. So I noticed in the deposition it was a fishing expedition, and now she might kind of try to clean up some of the fish so that he can't use it later in trial. So
We're in trial.
we're in trial. There you go. Yeah. Clean it up.
Okay. Good afternoon, doctor.
Good afternoon.
Melissa is representing?
Melissa Carter represents Jack. Jack Smith, 53-year-old,
There we go.
low back
All right.
issue.
Good afternoon, doctor.
Good afternoon.
Can you please state your name for the jury?
Andrew Philip Minista.
And what is your profession?
I'm an orthopedic spinal surgeon.
Can you please explain to the jury what orthopedic surgery involves?
I perform surgery that involves the bones, joints, and nerves of the body.
Could you just give us a very brief description of your educational background and training?
I received my music performance degree at the University of Miami. I then went back to school a few years later and did my post-baccalaureate work at Cleveland State University, and then matriculated into Case Western Reserve University's medical school. I graduated there AOA and went on to Johns Hopkins, where I did my internship, residency, and fellowship in spinal deformity.
And do you hold any board certifications?
I do.
Can you tell the jury what those are?
I am certified by the American Board of Orthopedic Surgery.
Very good. Any appointments with local hospitals?
Yes.
Can you describe those for us?
I am the past chief of staff at Capital Medical Center, and I am an attending physician at Providence St. Peter's Hospital.
He was referred to you by his physical medicine rehabilitation doctor, is that correct?
I don't recall whether it was that or his primary care doctor, but one of the two of them, yes.
All right. And if I could refer you to just your chart note on page 5. And, Your Honor, may I approach?
We're on? Yes.
Thank you. Thank you. Just looking at your chart note here, page 1 indicates that his physical medicine and rehab doctor referred Mr. Smith to you for consultation shortly after her time treating him. Is that correct?
Yes.
And I assume you took a medical history of Mr. Smith during that first exam?
I did.
How important is that to get a medical history from your patients during that initial exam?
It's fundamental to our ability to take care of the patient.
And you had an opportunity to review the chart notes from Mr. Smith's primary care physician and also his physiatrist, is that right?
Yes, I did.
Did it appear that Mr. Smith was an accurate historian?
Yes.
In other words, he was truthful in reporting his pre-existing conditions to you or his prior history to you?
Yes.
You've also had an opportunity, I know, to see the report from Mr. Smith's family medicine doctor, is that right?
Yes, I have seen the report.
And the family medicine doctor, are you familiar with him?
I am.
And how is it that you know Dr. Medicine?
A doctor of medicine and I are both on the medical staff of the hospital where I serve.
Okay. And can you speak to the reputation of Dr. Medicine in your community?
It's stellar.
Dr. Medicine indicates that he has been treating Mr. Smith for over 15 years. Is that important to you in terms of getting a history from your patient?
Yes.
Why would that be important?
It speaks to the depth of the relationship and understanding of the patient's general health.
And according to Dr. Medicine, Jack Smith had overall health that he described as, quote, very good. He had no chronic health conditions, and he went further to describe him as someone with a larger-than-life personality that seemed to have a very positive outlook on life. Were your findings consistent with that?
I found him to be a reliable historian, very pleasant, and the nature of his work was one of physical condition. So, in general, yes.
All right. And were you aware of any chronic health conditions that Mr. Smith had prior to the motor vehicle collision of October 26, 2015?
No, I'm not aware of any chronic medical conditions he had prior to or following.
And counsel for the defendant had an opportunity to ask you whether my client had a chronic condition in his spine prior to the collision. I have a slightly different question for you. Have you seen any evidence that Mr. Smith had a chronic active condition in his spine prior to getting struck by the defendant in October 2015?
No, I have not seen any evidence of that.
Okay. Counsel for the defendant also asked you many questions about my client's job in construction and questions about whether a construction worker could injure their back. Do you remember those questions?
I do.
Have you seen any evidence in your review of the records or in discussions with Mr. Smith or an examination of Mr. Smith that he injured his back at any time while at work?
I have not seen any evidence to suggest he injured his back at work.
Or that he injured his neck at any time at work?
I have not seen any evidence to that degree.
Okay. You also asked some questions about whether it was important to you that Mr. Smith waited 3 weeks before going to see his primary care provider after he was involved in the collision with the defendant. Do you remember those questions?
I do.
There's been testimony by Mr. Smith's spouse that he was having pain the weekend after the collision, and that he in fact went to see his primary care provider 2 weeks. He went to urgent care 2 weeks after the collision. Is that relevant to you in terms of the overall picture of Mr. Smith's pain and the cause of his pain?
The question being, would a 2-week delay to seek care be relevant to his case?
Coupled with his wife's testimony that he had pain immediately after the accident.
It is not uncommon for me to see patients several weeks after they've had an event.
Okay. Let's go to your treatment of Mr. Smith and when you did see him first in the spring of 2016. What were his complaints when you first saw him?
He complained of back and bilateral leg pain, left greater than right,
Okay.
as well as mild to moderate neck pain.
All right. And you ordered imaging, and what was the results of the MRI imaging?
The MRI imaging demonstrated degenerative disc disease C3, C4, C4, C5, C5, C6, C6, C7, and a herniated nucleus pulposus between lumbar 4th and 5th vertebra, affecting the left greater than right, with stenosis as well as degenerative changes.
Let's start with the findings in the C level. Can you explain to the jury where on the spine that is?
The cervical spine is made up of a series of vertebrae, the individual bones themselves. Frequently, we use the analogy that the spine is like an Oreo cookie, where you have cookie, cream, going down, with the cookies being the bones and the cream being the discs. The segments themselves are actually made up of a cookie cream, and cookie. So the difference between the bones, if we were to count C3, C4, would be the third and fourth bone and the disc in between that.
Okay. And the degenerative disc disease that you observed on the imaging of his cervical spine, does that in any way indicate that Mr. Smith was having neck pain prior to the motor vehicle collision?
It does not.
Why is that?
There's a study from several years ago, and forgive me, I don't recall the author's name off the top of my head, but they looked at asymptomatic individuals, that is to say people off the street without neck pain, and did MRIs on their back and neck and found that there is a high prevalence of these changes seen on MRI, even in patients that don't experience discomfort.
Okay. So are you saying that I'm over 30, I'm over 40. If I had an MRI done on my neck, but I'm having absolutely no pain, there may be some degenerative changes there?
That is more than likely the case.
Okay.
Objection leading.
Overruled.
And now let's talk about the findings on the lumbar MRI. Can you explain to the jury, and let's imagine that we have a model here of the spine. Can you show the jury where the lumbar spine is on our model and explain what we see on the MRI imaging?
So the lumbar spine would be the 5 segments of the low back that make up the area essentially from the end of the rib cage to the pelvis. And in each segment, there's a closed off area, a bony room, as it were, where the nerves that start in your brain travel through your spinal cord and then go down into your legs, pass through. And in this conduit, there's supposed to be significant room to allow these to pass freely. As we discussed earlier, the cookie cream, if the cream section or the disc were to move into that room or conduit that we have for the nerves, we then have a diminishment or decrease in the amount of space available for the nerve. And depending on how much pressure is exerted, the patient can experience dysfunction, either in pain, weakness, or numbness in the area of the leg that nerve goes to. So in this case, between the 4th and the 5th bone, we have some of the disc material exiting out of the back portion of the disc, entering into this conduit, the bony walls of which don't allow for additional room, and we have some pressure exerted on the nerves, more so on the left than on the right.
And did Mr. Smith's reported symptoms of lower extremity pain or numbness correlate with the findings you see on the MRI?
These are consistent with our understanding of his MRI.
Okay. And there was no evidence that Mr. Smith was experiencing any type of lower extremity symptoms before this trauma of the car crash, is that right?
That is correct.
How about evidence of any constant or severe low back pain before this trauma? Did you see any such evidence for Mr. Smith?
No.
What about this tweaking incident when he lifted up a bag of a 50-pound bag of cement at home and he, quote, tweaked his back, did 2 sessions of PT, and then he was okay about 6 months before the crash? Does that matter?
It is not uncommon for normal, healthy individuals to experience a brief episode of back pain when they take on an unusual activity.
If Mr. Smith had a herniated disc, such as what you have diagnosed him with after the motor vehicle trauma, if he had that condition 6 months before the car crash and tweaked his low back lifting a cement bag, would you expect him to continue to have pain and limitation for the next 6 months if that was going on before the car accident?
Objection leading.
Somebody wake up the judge.
Overruled. You can answer the question.
Let's keep going.
Please repeat the question.
Sure. if Mr. Smith had this herniated disc that is causing the symptoms into his lower extremity before the car crash, 6 months before, in fact, and he lifts the bag of cement and tweaks his low back and goes to the physical therapist, would you expect him to resolve as quickly as he did with just 2 visits of physical therapy?
No, we would expect the constellation of symptoms to be different, and we would expect the treatment to be different.
Dr. Medicine in his report indicates in the second paragraph that it's safe to say that Mr. Smith was fixed and stable and asymptomatic in his low back at the time of the October 2015 motor vehicle collision. Does that statement mean anything to you?
It does.
Can you please explain to the jury what that means to you and why that's important, if it's important?
It's important to me because it states that Mr. Smith had an intermittent episode of low back pain that was treated, had resolved, and was not currently bothering him at the time of the motor vehicle accident.
What was your recommendation after your examination and diagnosis for Mr. Smith?
My recommendation after discussing the further conservative treatments with him and possible operative treatments was to consider having a transforaminal epidural steroid injection and to continue his home exercise program versus having a decompressive type procedure where we would make more room for the nerve.
And what ultimately ended up happening?
He and his family elected for the decompressive procedure.
Can you explain to the jury what that involves?
In this case, it involved removing the back wall of that room or corridor we described, and then carving larger exit holes for the nerves as they leave out of the spine, and removing a portion of the disc material that had exited the confines of the disc.
Okay. How did he do?
He did modestly well. He had improvement in his symptoms, but not complete resolution.
Is it fair to say that but for the trauma of the October 2015 collision, Mr. Smith would not have experienced the constant symptoms of pain and numbness in his low back and lower extremity?
Yes, it is fair to say that, in my opinion.
Is it fair to say that the trauma more probably than not lit up his pre-existing condition in his low back?
I think in this case, it's actually the most likely, more probably than not, reason for his herniated nucleus pulposus itself, which is more likely than not a new condition, would be the motor vehicle accident.
How about the stenosis that's noted on the MRI? Did he have stenosis before the accident?
If he did, he was not clinically aware of it.
And if he was not having symptoms, that would be called asymptomatic, correct?
That is correct.
Fair to say that any symptoms that were that became lit up in terms of his stenosis condition, that was caused by the trauma?
Yes.
I'm going to show you the bills for the treatment related to his surgery as well as treatment with his physical therapist and physiatrist and primary care doctor, and those bills look like they total around $80,000. Do you see those?
I do.
And you have an understanding as a reasonable and customary amount to bill in this community?
Yes,
Do those bills appear to be reasonable and necessary and related to the treatment he required
they do.
as a result of the collision?
Yes.
Okay, doctor, I have nothing further. Thank you.
Thank you, counsel. We'll now hear from the at-fault party's attorney.